The main findings of the THEMIS trial are a 10% relative risk reduction in the primary endpoint of cardiovascular death, MI, or stroke that was statistically significant. The THEMIS trial is in fact the largest trial of diabetes done to date. Over 19,000 patients with diabetes and chronic coronary artery disease were randomized to ticagrelor or placebo on top of low-dose aspirin. What we found in the overall trial was a significant reduction in the primary endpoint of cardiovascular death, MI, or stroke, a 10% relative risk reduction that was statistically significant. Now, this is a large population of patients with diabetes and chronic coronary artery disease, but we wanted to see within that population which patients really benefited the most. And in a pre-specified analysis, THEMIS PCI, we looked specifically at the 58% of the population in THEMIS who had a history of previous stenting. On average, that was about 3.3 years prior to entry into the trial. So this isn't recent stenting we're talking about, but stenting in the past. And among this cohort of patients, there was a 15% relative risk reduction that was statistically significant and also a better bleeding profile than in the no PCI patients. So overall, what we've interpreted the trial to mean is that in the patient with diabetes and with chronic coronary artery disease, with a history of previous stenting in particular, that's the sort of patient that could benefit from intensified antithrombotic therapy, in particular aspirin plus ticagrelor versus aspirin alone.